Filler. A few years ago, the filler was like for really expensive. Like 1 cc usually costs like if you do a like hard diet and if there's a remnant of fat in a specific area, the LAMS is much better. Your body shape, if you want to get rid of the specific area like arm, thigh, the liposuction is better. It's not that much difference, but the main difference I think is the operation time and you need to wear a compression garment for 4 weeks. I will see your thigh. You can stand up for a few seconds. Okay, you can sit down. And is there like some specific like model or person you want?
Yeah, I wanted to get the fats between the side, take it off, and also a little bit from here. And as you told me, I can put some of the fat for the upper butt so that it can make the proportions better.
If you do a liposuction, usually we just get rid of it, but some person who wants to get your butt lift or fat graft, we can reuse it. And I think it'll be better for you to have a fat graft in the upper buttock area so that your waist could get a little bit shorter and the legs could get longer.
It's better to inject the fats of the body than another
filler. A few years ago, the filler was like for really expensive. Like 1 cc usually costs like $150. That's really expensive. But these days, there's like large volume fillers coming out. Some people usually put it on the shoulder or buttock to make it more volume, but I don't think it's because it's not an autologous tissue. So if some problem comes up, like infection or something like it, it could get bigger. And for you, Mina, it's like what in plastic surgeon thinks the thigh fat is really good. It gets grafted very well than other part of the area. So the thigh fat is a high quality fat. So I think it's better to use a fat graft.
Yeah, is it okay to do more than one area at the time?
The thigh and the arm. Usually if some person who want to do the whole body, I recommend to do divide in upper and lower. Like if you want to do abdomen, back, and like brow line, arm, and thigh, I recommend to do the thigh later. But for you, like only thigh and arm, it's okay. I think if I do liposuction in your thigh, it may be like 3,000 to 4,000 cc, and in the arm is like maybe 1,500. So I think it's a little bit large volume suction, but I think that's okay. Anything else, I will recommend to do delay later.
Another question, is there any pain during or after the procedure?
Usually it doesn't really ache that much, but what's the problem is like patient gets a large volume of fat getting out of your body, so the body temperature gets lower, so it could be freezing cold. That goes away next day, and liposuction is not that much than other operation, I think.
Like how to keep the results after the
procedure?
What kind of diet should I use?
You have to, patient do is like they go home and after like 1 or 2 weeks, your condition gets better. They eat a lot because they think it's like a lot of fat already have gone out. So it's okay to eat a lot of food. You should control your diet, but just wearing a garment is the almost only thing you have to do.
When can I see the results?
You can see almost like 80% of the result in 1 month. Usually the irregularity comes when the swelling comes down, and the irregularity gets better after 6 months. So that could be an answer.
Is there anything I need to do to prepare for the procedure?
There's nothing specific, but it's better to quit the vitamins or like omega-3 before like 4 weeks, because it's not a medication, but it could make a bleeding tendency a bit. It doesn't matter that much, but there could be a bit more bruise than the patient who doesn't eat that those stuff.
Okay guys, so this is the station, exit number 10. So the place is in Gangnam. This is our building, 3rd floor, AB Clinic.